All right, everyone. Thank you so much for joining today. We are thrilled to have some fantastic panelists for our April 2025 RDLA webinar. Before we get into the panel discussion, we would just like to welcome everyone to the call. And as a reminder, if you would like to ask a question, please type it into the Q&A box and a member of the RDLA team will direct them to the speakers. As a reminder for media, we do ask that you formally announce your participation and refrain from quoting any of the discussion during the webinar. If you would like to get a quote, please reach out directly to the participants after we complete the call. As a reminder for attendees, this webinar is being recorded and will be made available on our website shortly following the call. We would also like to extend a thank you to our sponsors for today's webinar. This would not be possible without their assistance. Finally, there are going to be closed captions available for all of our RDLA meetings. Please click live transcript at the bottom of your screen if you would like to access these. And with that being said, we will go ahead and move into our panel call for today. It's going to be moderated by Annie Kennedy, and then we are joined by Clay Alspach, Shane Wood, Caitlin Van Sant, and Remy Brim. Thank you so much.
Great. Thanks so much, Kenley. So good afternoon, everybody. I'm delighted to be here with all of you. My name is Annie Kennedy. I'm our Chief of Policy, Advocacy, and Patient Engagement here with the Everly Foundation for Rare Diseases. I'm going to take a moment to read the bios for our guests here today. These are some of the best and brightest who we have here in our nation and our nation's capital, and some of the folks who we turn to at the Foundation for counsel as we are navigating all circumstances, but especially navigating strategy on behalf of our rare disease community. And so I'd like to take a moment to tell you who we have. We're really grateful to them because they continue to show up for us time and time again. So for those who are at our Community Congress annual meeting and those who are with us at Rare Disease Week, you will recognize them. And you will probably also be struck by how much times have been changing, even since we've heard from them in December and then just a couple weeks ago during Rare Disease Week. So I'm going to start with Caitlin. Caitlin Van Sant is a senior healthcare and domestic policy expert with more than a decade of experience in state and federal government affairs. A lawyer by training, she served in senior staff positions in the U.S. Congress and with 3 separate trade groups representing diverse healthcare stakeholders. She joined Melman Consulting in 2022 after serving as legislative director for Congressman G.K. Butterfield, a senior member of the powerful House Energy and Commerce Committee, and a former chair of the Congressional Black Caucus. So welcome, Caitlin. Next, Remy Brim. Remy is co-head of the Health and Life Sciences practice and, along with John Stone, co-leads the FDA and Public Health Working Group. Remy joined the firm after serving as the senior FDA policy advisor to the Senate Health, Education, Labor, and Pensions Committee, ranking member Patty Murray. In that position, Remy was the lead negotiator for Senate Democrats on all FDA-related legislation, including the 21st Century Cures and the FDA Reauthorization Act. Previously, Remy was the senior health policy advisor to Senator Elizabeth Warren, managing a comprehensive healthcare portfolio. Remy is a scientist by training, holding degrees in microbiology and molecular genetics, as well as a doctorate in pharmacology. Shane Woods. Shane currently serves as vice president with Alpine Group's healthcare practice. Shane provides critical strategic advice to clients across multiple industry sectors, including healthcare and technology. He creates and implements comprehensive legislative grassroots action plans on matters pending before the legislative and executive branches of government. He also builds and maintains key coalitions to achieve desired outcomes on behalf of clients. Previously, Shane served as the senior legislative assistant for Senator Tim Scott of South Carolina. In this capacity, he planned and developed legislative initiatives while tracking legislation. He also served as senior policy advisor for Representative Gus Bourakis of Florida. And last but certainly not least, Clay Alspach. Clay is a principal of Levitt Partners. At Levitt Partners, Clay leads alliance efforts for orphan drugs and sickle cell disease and serves as the executive director of the Alliance for mRNA Medicines. He also advises clients across the healthcare landscape. Before joining Levitt Partners, Clay served as the Chief Health Counsel for Chairman Fred Upton of the U.S. House of Representatives Energy and Commerce Committee. At the committee, Clay spearheaded a number of legislative initiatives, including the Food and Drug Administration Safety and Innovation Act, MACRA, Drug Quality and Security Act, Pandemic and All Hazards Preparedness Reauthorization Act, and the 21st Century Cures Act. So thank you. We welcome all of you. And I think it's noteworthy to say that in all of those roles that each of these individuals have served previously, they've worked closely with our rare disease community. So we thank you for your leadership, both previously and now. So we're going to dig in. We invite you to come off mute and dig into this conversation with us and not necessarily go in order so we can get into a robust discussion here today. So we are, I believe, 92 days into this administration. As I mentioned, you guys have been generous enough to have been with us in December at the end of the year. We were leaning into what we anticipated the administration might look like, and as the community was sort of laying out our hopes and expectations for how we would engage with the new administration and the incoming leadership. And then some of you were with us again at the Rare Disease Week when we were together just a couple weeks ago. And a lot has happened in that time. So we also have seen a series of executive actions. I saw somewhere that there have been, I believe, 129 executive orders that have come so far out of the President Trump. So maybe we could just do a little bit of level setting for those within the community who maybe haven't been tracking as closely or don't have a firm grasp on maybe the impact that some of the administration's executive actions have had specifically on the rare disease community and our biomedical and health ecosystem. So as of today, April 22nd, let's just do a little bit of landscape setting. Where are we? What have we seen as far as priority setting and sort of some of the shape shifting that's taken place? So whoever wants to start, and then you can all sort of build off one another.
Well, yeah,
Shane.
sure. Annie, I'm happy to, take a first stab at this and then, have my colleagues, fill in. So right now we've certainly seen a lot that's happened with regard to reorganization efforts at the mothership of HHS, impacting, research funding and academic institutions as well. The biggest thing that we've, certainly seen here in the last few weeks is a substantial reduction in the HHS discretionary budget, by over about 30%, of course, potentially impacting the rare disease community, specifically, NIH, seeing a proposed budget cut from about 48.5 billion to 27.3 billion, with, plans to consolidate their 27 institutes into 8, which of course has certainly raised some concerns within the rare disease community around the future of research. Additionally, we've seen a lot of rifts or reduction in force, which has certainly impacted the workforce, and bringing that workforce from approximately 82,000 to now 62,000. And so, again, a lot of plans to, close regional offices and merge various industries, which again can, has the potential to cause a lot of disruption in, how, rare disease community is able to, access vital services. Additionally, we saw, most recently an executive order put forward by the administration around addressing the high costs in this country. A lot of plans, from administratively things that they can do out of the executive branch, but then also calling on Congress as well to take up, the power of their pen to address some of these things as well, which we can certainly, delve into later with regard to the implications there, with specifically with regard to the EO.
Awesome. Thanks, Shane, for getting us kicked off.
And I can build on that if that works.
Yep.
Yeah, Shane's exactly right. And we've seen in this first 92 days, significant amount of disruption and the executive orders that have been put forward. I think we're still seeing the early stages of it. This is something is the first 100 days is I guess one of those measuring sticks, right, that we put forward for a presidency where you see how much is accomplished. Usually that's measured in legislative work or legislative action. That's, I don't know if you go back to like FDR, some of the historical notion. This one is going to be measured by executive action. And so we're seeing those executive orders come forward. And I think one thing with executive orders, President Trump has held these signing ceremonies where he's signing them. But like the drug one that came out last week, some of those, like as much as they're signed, the implementation and what comes forward is going to take a few months or could take a long time to actually come to fruition. That's not the case, right, for what we've seen with the Department of Government Efficiency, the DOGE efforts, and what the impact they've had on the HHS workforce that Shane was articulating and did a great job of doing that, where that has had a direct impact. And so since we last talked during Rare Disease Week, we have seen that those cuts come forward at FDA, right? We've seen that at NIH and some of the impact on grants that have come forward, and that has had a very dramatic impact for the rare disease community. We saw some of our biggest champions, Peter Marks as one example, who his resignation was forced, right? He's no longer there. Other very important leaders are not there. And so where we are now is still trying to understand and just the impact of that, what that looks like long term. But of course, short term, some of that information is coming forward in anecdotes, other pieces as well. We have seen some of that direct impact in terms of you could argue it's related, right? Where Rare Disease Week was canceled, like we had the meetings canceled. We're seeing some of those, and we were just talking before we got on, right, about where does it go from here? How do we move forward? So we're seeing that. And then I'll just close and let my colleagues come in. But one thing that has moved forward that we still see is that Rare Disease Innovation Hub. So that's good news, right? That's still there. Amy Comstock-Rick, a great leader, she's there. So I think there are some positive pieces that we're still be able to work, engage, and do that. But we don't want to sugarcoat it. There have been some dramatic impact that we've seen in this 92 days that I think are going to will have consequences for us, both short and long term.
Thanks, Clay.
I think the comment, there's been a lot of disruption and things have been moving very quickly, sort of borrowing from the tech world's move fast and break things mantra. That certainly has been a theme over the last 92 days. And I think we're still, as advocates, but also the administration are still trying to figure out exactly what that looks like moving forward and what the implications will be. You had Secretary Kennedy say, well, if we make mistakes, we might bring folks back, and we want feedback on how this is shaking out. And so that might be difficult to do if those folks find other jobs in the meantime, but at least there seems to be some openness to having this be like a process that can evolve based on need. So it will be interesting to see for the next couple months what further decisions come out of the administration. The president will have to release his proposed budget, which will, probably contain more detail on what his vision looks like, and have the secretaries come to Congress and testify to that vision. So hopefully we'll get a little more clarity over the coming weeks and months.
Great. Thanks.
I love going last on this panel because all the smart people have such great things. And again, Annie and the whole EveryLife team, thank you for having me. I agree with all the panels. Like, there's a lot going on. There's a lot of things coming at us. You see a lot of things in the media. You see a lot of, there's a lot of churn. There's a lot of things to be concerned about when you think about preserving FDA's function, research, all of those different things. I think there are a couple bright spots that I'll lean on here in these times. In the sort of leaked HHS budget that my panelists talked about, one thing folks have been worried about is the FDA user fees and what that looks like next year. They have budgeted for those user fees. They acknowledge there is this thing called a trigger, which means that FDA has to get a certain amount of money and spend a certain amount of government money in order to unlock those really important user fees. They are saying yes to all of those things. They are going to move that forward. So that is comforting for 2026. We have heard anecdotally from companies that have products under review at FDA that it's their fastest FDA reviews they've ever gotten. They have been getting meetings. They're mid-review meetings, mid-cycle review. Those are coming faster. FDA is meeting deadlines earlier. Some folks are, they're getting more information back than they had been prior. And so you can tell that FDA, because of all this turmoil, is really trying to lean on making sure that base function, we know FDA does so much, but that base function of reviewing new product applications, they're really pushing to, show progress there. The other thing I would note is this administration is really, really good at messaging. The press is not always as good as seeing through the messaging and reporting what's actually being done. And so I think it's important to the extent possible, and EveryLife does a really good job of this, of sort of, providing source documentation and really unpacking what's happening. I'll use the example, last week, FDA announced that they would, maybe it was the beginning of this week, I don't know, it all runs together, that they were going to try to reduce conflicts of interest in FDA advisory committees, and that they were going to eliminate the sort of industry influence over AdComs. The fact of the matter is, there are not voting members from industry on AdComs. That is the status quo. For members of these AdComs that are non-voting, that are industry, a lot of those folks are mandated to be on these AdComs by law. They're non-voting. They're there to provide a perspective to those AdComs. So, while the press might pick this up as, oh, there's this thing happening, and they're changing the composition of AdComs, which are really important, especially for the rare disease community, because it gets that patient voice out there. That's not going to be a big change. And so I think it's important, especially in these times, as we're seeing these big kind of scary things come down the pipe, which I agree with, it's disturbing what's happening at NIH and some of the proposals for FDA. There's other things that are working well, and there's some things that are not. Not everything is hair on fire, which I try to find a little bit of a bright spot when there's so much coming down the pipeline.
So that's actually a really nice segue, Remy, and we might stay on you for a second or shift to whoever wants to go, because you helped us sort of say what Caitlin started, and you shifted us a little bit really beautifully into shifting sort of from what's happening at the administration level to what's happening at the agency level, now that we have Commissioner McCary and then Director Bhattacharya sort of in place, and really trying to figure out now, while recognizing that there have been really significant shifts to personnel, and now we saw last week even a leaked budget proposal for FY 2026 that may have additional shifts and reorganization coming. We are starting to be able to read tea leaves maybe for what these agencies might look like and what some of the philosophies of the new leadership might look like. So Remy, you talked a little bit about needing to unpack that further when you're seeing what comes out of trades and comes out of media, and really start to understand the philosophies of these leaders. So that's a really nice segue into thinking about, so some of that's been coming out of FDA. And so some of that was around advisory committees. Does anyone want to address a little bit? Commissioner McCary did an interview with Megyn Kelly last week that's picked up a lot of interest in the rare disease community. Can we talk about that a little bit as well? Remy, maybe you want to kick that off, and I saw Caitlin come off.
Yeah, it was a wide-ranging interview. Talked about all sorts of all the different regulatory pieces within FDA. But the thing that's really piqued interest was about a paragraph or two long, his commentary on the FDA's approach to clinical trials and evidence generation for rare diseases. And he was really talking about, the example he used was sort of 75 patients in the world, right? These sort of ultra rare, there is no formal definition, but I think, colloquially we could agree that that is a very low number. And the point he made was, can we look at biological plausibility and use that as a way to approve products and then follow them post-market? Remy Brem's interpretation of that is it's a little bit of a conflation between the most aggressive use of its current accelerated approval processes mixed with a little bit of the policy development work that's been done by the sort of N of 1 and ultra rare disease community for especially ASOs or antisense oligonucleotides to say, we are not going to have a clinical trial, right? But we might be able to have a backbone that we can demonstrate and know that it could correct a particular genetic defect. We know that we could plug and play, right, different sort of base pair modalities into that, and it would still work. FDA under the previous administration thought that they needed new authorities from Congress to be able to take an approach like that, which would almost look a little bit more like a medical device or more like a diagnostic testing regime where you would almost like certify a facility and then follow things post-market. Whether he was nodding at that or whether he was nodding at being really aggressive on the interpretation of accelerated approval, or whether he was nodding at something else they're cooking up, it's not totally clear. But it was good to see him talking about, rare diseases. It's clear that there has been advocacy that has resonated with him and wanting to move forward with this. And remember, this is the administration that advanced the right to try bill back during Trump 1, and the mentality of wanting to make sure that you can get potentially beneficial therapies to patients faster is something that this administration, globally is going to try to keep pushing for in the drug space at FDA and beyond.
Yeah, absolutely. So it's fair to say there will be more to come on this, and that the community should be following that closely. But I think it's again, we're in a reading the tea leaves stage of really understanding what the priorities may be of the new leadership that's coming into these positions. So I was really heartened to hear Remy reporting out that there are companies that are having really positive interactions with those that are at FDA. I think one of the things that the community has been really concerned about is what are the impacts of some of the staffing reductions been. First of all, because we certainly have a lot of care and respect for the people who have done these positions for so long, and the public servants who are no longer in those roles, which I know is something we all share. But also then we're concerned about the pipelines that our family members are so dependent on and that we've invested in for so long, and what are the future of those pipelines and how are these changes affecting them. So that's a really positive signal and sign that that those who are there are working so hard to continue to move things forward. Similarly, have any of you had interactions with any other agencies? So whether that's NIH, CDC, CMS, where you're getting any indications of how things might be progressing and moving within those agencies?
We've had a lot of productive conversations with CMS. I would say that agency is sort of the most business as usual. There hasn't been a big, there's not big reorganization plans coming out of CMS. It's our health insurance arm. So it's a little more boring and less sexy to an incoming administration trying to do things like messaging. Certainly, there are things going on there politically. We are watching everything going on with Medicaid, but the things we're watching in Medicaid are much more congressional focused, very much business as usual when it comes to Medicaid within CMS, and folks have been generally responsive, right, and talking about some pretty granular issues in terms of the outpatient rule and the inpatient rule and all of these rules that are critical to supporting the healthcare infrastructure around the country. And so I think that is another positive sign. Whereas I think some of the scientific agencies, because of the impact of the layoffs, because of potential restructurings that are ongoing and loss of leadership or change in leadership, it's been, I would say, more tumultuous in those locations.
CMS has also been more insulated from the reductions in force than some of the other agencies. So I think that that's really helped in maintaining like a steady presence with career staff as the political staff get set up in engaging with stakeholders, sort of, as Remy said, business as usual. I have noticed that the Make America Healthy Again rhetoric has sort of filtered down to a lot of aspects within HHS, including its CMS. It seems like they're looking for ways to plug nutrition into spaces where maybe they hadn't before, or other issues that sort of fall under that healthy umbrella that Secretary Kennedy has made a priority. So that's just something else to watch for.
That's great. Thanks.
Yeah, and if I could add to those two, on some of these efforts too, though, I would just argue that we should, there could be additional cuts or additional changes coming, right? And that's where I think those questions are still lingering over. We saw the leaked budget document. We've heard about structuring, about like an ARPA-H combining with BARDA, like some of these other changes, which could have a significant impact. And so I think that that's just bears watching. On the NIH side, we have direct reports where there are grants that are being cut, right, and where money is being stopped, and so that's something to flag. And I think in working with that community, I think there is a chilling effect that has been placed upon it, where just that's the blood, like that's how this is funded, right? That's where everything comes forward, and so I think there's a particular concern around young researchers as those who are entering the field, where and how is this research going to be? Is NIH going to? Is it for the foreseeable future or in the future? Is this going to be a good way to proceed a career, or do they have to look at other opportunities, or frankly, are they getting recruited by other countries or other organizations to try to pursue that? So I think that's one thing to flag. But again, we're really early. I think we're still seeing this unfolding. And so I think one thing to think about, there's just so much coming forward, right? So many statements, so many things being released. It's really watching the actions that come forward. So really. So I think that's what we need to watch, right? Are the specific pieces that come forward and how that actually bears out. So it's not what comes out in an interview. It's like, what is the actual process that's going to be out? Is there going to be a guidance that comes forward from, provides information on or regulation that comes forward on this new approval pathway, or this pathway for rare diseases? That's what bears watching. So obviously some really interesting and I think promising ideas coming forward, but let's see what actually comes forward, and remain hopeful that will provide a good avenue for for rare disease products as they're facing the challenges.
Yeah, no, that's a great point. I think though, I just want to make sure, because I think sometimes we talk sometimes in shorthand. So I want to make sure we just I think we've thrown out a few things that I just want to make sure that for those who are listening, we kind of take these in order. So I'm just going to recap some of the ground I think we've covered before I transition to the next set of questions. And you guys correct me if I conflate something. So we sort of started with, in the beginning of April, and maybe even just a little bit before the beginning of April, there was sort of that first round of budget reductions that really hit the HHS workforce. And that was really the first landscape shift we felt across HHS, which I do believe happened right around April 1st. And then in addition, right before that, many folks within HHS were offered opportunities to retire early. So some folks were affected by what were referred to as RIFs, or reductions in force, but there were other incentives for those who were close to retirement that could take those opportunities. There was that layer of people that were considered probationary, so either had a new role or a new position, or had a transition in their position within 2 years. So there were a lot of different factors that, came together that impacted the staffing levels and then the budget levels. Those who've been following our communications and what we've been tracking, there was also a period in which the indirect rates, so the way that NIH funds academic centers, was impacted, which that's still sort of being litigated back and forth, but that had significant impacts on our research ecosystem, and many academic labs and clinical trials were impacted, as well as graduate school programs. So that was sort of one of those first impacts we saw sort of nationwide, because as we saw, many of the local economies were affected by those academic institutions and what those impacts were. But then we sort of had this next level, next layer that we saw. And that really, we felt that across our newborn screening ecosystem when we saw the suspension or the termination of the Secretary's Advisory Committee for Heritable Disorders in Newborns and Children, because many of the what are referred to as discretionary advisory committees, so advisory committees that no longer were mandated by legislation, were then eliminated. And that was one of those advisory committees, and that was eliminated. And so those in our community have been very engaged in activating and advocating for the reestablishment or restoration of that advisory committee, because we know how important that committee is to adding conditions that have met the evidentiary requirements for newborn screening to the federal newborn screening panel. And then something else we've been talking about here, but we probably didn't go into a lot of detail, and so maybe someone can fill in some gaps, is that something that happened, I think it was even last week, is that there is a process by which the president typically introduces a budget proposal for the upcoming fiscal year. And typically that's just the president's sort of wish list budget, and then Congress typically then counters and does their own budget work. And in that budget proposal for FY 2026, the president's budget has more substantial cuts proposed and coming. And so we've talked about some of that includes consolidations to NIH institutes, additional potential cuts to HHS staff. We just talked about the consolidation of BARDA and ARPA-H and NCATS. Those are all in a proposed budget for FY 2026 that was leaked through the Washington Post, but has not received a lot of countering and pushback. And because of the way that Congress and the White House are working together, it's being taken very seriously right now in this context. So I just want to sort of layer, those are separate actions that have occurred, and we're sort of talking about them all together here. But for those who are just hearing about all this for the first time, I sort of wanted to layer them in different activities that have happened that we're sort of all dealing with together. Did I miss anything or misstate anything that you guys want to share?
No, I think that was a really good overview, Annie. As far as the leaked document, so, just to clarify, that's, colloquially speaking, a passback document between HHS and the Office of Management and Budget. It's,
when you say passback, what does that typically mean? What does that
yeah,
mean?
so essentially this is effectively internal, for lack of a better term, internal discussions that are occurring within the executive branch right now. So this is not a document that has been by any means transmitted to the Hill. It's not been transmitted to Congress. These are internal discussions that are right now happening within the executive branch around how to shape that FY 26 budget that will be eventually transmitted to Congress. So we expect to see at some point, probably a skinny version first that's going to be transmitted to Congress, followed by the more robust official president's budget for fiscal year 26. And so, we're certainly keeping a beat on that here at the Alpine Group. We expect to probably see that somewhere in the June timeframe transmitted to Congress. But those internal discussions certainly, are very telling with regard to, where the administration sees, quote unquote fat within the agency, and where they are potentially targeting areas for cuts. By no means is this a finished product. Certainly subject to change before that's ultimately transmitted to Congress. But again, it just really provides some perspective on those internal conversations that are occurring right now within the administration.
That's great. And that's where we also, though, where we saw that glimmer, and Remy sort of highlighted the opportunity for the user fee agreements, right? That FDA, within that document, FDA was the potential and the intention was to continue to fund FDA at a level that would enable the user fee negotiations to proceed as intended. So that sort of glimmer came from that document coming out. Correct, right? Because we're looking for all of those opportunities as a community for continued advocacy and activation.
And Annie, I just want to echo, like, I thought your overview was fantastic, in providing just some clarity around just different topics that we discussed. And it also, I think it emphasizes, just one reemphasizes like the actions piece of this, where like even a budget document, it's important, right? Because it provides an understanding, a glimmer as to kind of what the vision is. But like when I was in Congress, when we received the budget from the president, I'll just be like glib, but like we kind of threw it in the trash, right? Like it wasn't really worth it. Like, great, you have a budget, we're provider perspective, but it's not gonna, when the president's budget never gets passed, right? We've never seen that happen. Usually the Congress wants to write its own. We'll have to see how this year progresses. But one of the things we're in the middle of is a test of executive authority. This is like a deeper, maybe like a series of webinars, law professors could come in, but how much authority does the executive branch, does President Trump have to actually do some of the activities that are articulated or what we saw in that budget document? I think that's a question that we're going to have to wrestle with as a policy community to see. Some of them may provide, maybe really great ideas, some may not. But like, what to come to base, like, where's the executive power to do that? Some of these agencies are authorized by Congress and were put forward by Congress. Can the executive just pick it up and put it somewhere else? I think those are some of the questions we're in the middle of an ongoing test on some of these really fundamental constitutional questions.
And where will we see some of the signs and signals that will tell us, like, how is that playing out? Like, will we see that there's an upcoming appropriations committee hearing? Like,
That's it. I mean,
some of those?
I think there's a question in the chat, right? One of the hopeful places that we thought we were going to see it may still is that there was an invitation by Chairman Cassidy to come to the Help Committee for Robert F. Kennedy Jr. to come and talk about it, right? To get more information on what's this restructure look like? Can you give us more information? Because at that point, the Hill hadn't been frankly gotten the information. I think they were understanding and learning about this just as we were as a community. And so I think that's one place where we'll see this, is not like through congressional hearings where more information is coming forward. I think that's at least one place. And then, but I'm curious what my colleagues think as well, like where else we'll see this.
Yeah, I mean, I think also you'll see it in the budget hearings, right? It's sort of part of that, like when you have these folks actually coming to the Hill and talking about these things. And then when you start to look at appropriations hearings, is there, I agree with Clay's assessment. We always would say, like, there's all this hubbub of the president's budget, and the purpose of the president's budget is to educate the trash can. Like, no one ever would take up the budget, but I think it carries some additional weight because it is there's a lot of really dramatic ideas in there. There is, and I saw a comment in the chat about the newborn screening program. That budget basically said, we're not doing that program anymore. And we already know the advisory committee has been dissolved as part of the wiping out of a lot of different advisory committees across HHS. And so that hasn't happened. The newborn screening program does still exist. The RUSP still exists. But, right, what does that mean going forward? It hasn't been reauthorized because there has been some concerns. And again, I saw the comment in the chat, there's been one member. It's more than one member. One member sort of takes the fall for it, but there are several members who have sort of concerns over the data privacy issues. And that's sort of held up being able to reauthorize the program. And I do think that once we get out of this first 100 days, once we get past this reconciliation process, which we haven't really even touched on that yet, we know that is the process ongoing in Congress that Republicans are undertaking to move forward with some of their tax priorities, which could pull in, potential cuts to Medicaid. Once we get past that, right, then it's like, okay, what is the job of the authorizing committees? There's a lot of things that have not been reauthorized in a long time. Newborn screening's one. NIH is almost 20 years overdue for an authorization. That program doesn't actually exist in law. It sunset a while ago, right? It hasn't been through that process. And so, I think that there is going to be potentially a stronger desire to get some of these things done, authorized officially on the books in the way Congress wants them. That involves some bipartisan collaboration. We're gonna have to get through this time to see how much bipartisan goodwill remains. But I do think over the next several years, there is going to be sort of this reckoning of like Congress and the authorizing committees needing to make sure they're doing their jobs to codify these important programs so that there is sort of there's less authority within the executive branch to make draconian changes if you have executive leaders that have very different ideas about what these programs should be.
Yep. So let's talk about Medicaid if we can, and why Medicaid is such a hot topic and why it's so vulnerable right now. So can we just maybe back up and talk about why Medicaid is subject to potential significant cuts at this moment, and then maybe coming out of that conversation, talk about how the rare disease community can be active on this issue. So can we just do a little context setting for everybody first?
Reconciliation 101. So the president has some very strong tax priorities, and congressional Republicans have very strong tax priorities. Is the extension of the Tax Cut and Jobs Act from 2017. That was their signature tax bill. And they want to make changes on the border security and immigration as well. Because Republicans control both the House and the Senate, as well as the White House, they've unlocked this tool called budget reconciliation. Budget reconciliation is a tool to pass bills that have a budgetary impact, and they do not need 60 votes in the Senate. So when you don't need 60 votes in the Senate, if you have a simple majority, which the Republicans do in both chambers, and you have a Republican president, right, they're likely going to pass the bill that both chambers pass. The thing about budget reconciliation is because it has this special pathway and because it doesn't need 60 votes, it can only do a limited number of things. You can only do things that have an impact on the budget. So you can't do NIH policy, for instance, because that goes through the appropriations process and that is not mandatory funding. It does not have a budgetary impact in the way that the Congressional Budget Office works. And so the administration and congressional Republicans would like to do their tax cuts, but all of these things cost money. And of course, they don't want to put forward a bill that costs a lot of money, right? We try to be, in DC, we like to be budget neutral. We always say, well, how do you pay for it? So what are the things you cut when you want to spend money in other places? And so if you do a tax cut, that is like spending money. The president has made a commitment that he's not going to cut Medicare or Social Security. So those are two pretty big pots of money that you could use to pay for it, but those are off the table for political reasons. And so what's left? There's not a lot left on the table. One thing that there's a lot of money in is Medicaid. And so because Medicaid doesn't fall into the Medicare bucket or the Social Security bucket, and there's a lot of spending going on the tax side, Medicaid is sort of now on the chopping block. This reminds me a lot of 2017 when the Affordable Care Act repeal and replace effort was going on. There was a lot of conversations about Medicaid at that time as well. And it was really strong advocates that stopped what was happening in 2017. I mean, there was protests in those office buildings every day about whether it was, Affordable Care Act, whether it was Medicaid. There is not a good understanding of folks and staffers of what Medicaid really is. And, I hate to say that, but, there is such turnover in Congress, even folks that might have gotten that education a few years ago, they're not there. And so folks are having to realize that, okay, Medicaid covers most kids. Medicaid is the one that is covering most of these really innovative gene therapies. Medicaid is called something different in every single state. Medicaid is financed through a lot of different creative financing mechanisms that go on in each of the states, and they're all different. And so that is why Medicaid is on the chopping block right now, not because people have a problem with Medicaid per se, but because they are trying to effectuate other policy areas. There's a lot of language being used about fraud and abuse. Like, oh, we're not cutting Medicaid, we are cutting, quote, fraud and abuse. What they're talking about is not what I think colloquially we would think about as fraud and abuse, but rather some of the financing mechanisms that states use to collaborate with the federal government. And so I think it's just something to keep in mind as we hear lawmakers talk about these things, that when they say fraud and abuse, they actually are talking about programmatic cuts that would result in less money to states, and states would have less money to spend. But I will pause with that, and I know Caitlin wants to jump in, so.
Yeah, no, thanks, Remy. I think another, I thought Remy's summary was excellent. Just another thing to point out in terms of where within the Medicaid program we can expect some of these funding reductions to be proposed specifically is more so on the ACA's expansion population. So that is not to say at all that kids and folks who access Medicaid because they're elderly or disabled or pregnant women won't be affected. But I think, to Remy's point about fraud, waste, and abuse, you're hearing a lot about, personal accountability. And if people want to have health insurance, they should, be working or volunteering or be a caretaker or things like that. So a lot of the proposals out there are sort of under that umbrella of we're not cutting benefits, but we're making sure that people are accountable, that states are accountable. So but that language can also be used to hide, a lot of potentially detrimental policies to the program. And I'm sure my Republican colleagues on the call also have a perspective and point of view here. But as we see the committees come back from the spring recess and start to examine these policies more in depth, I think you'll be hearing a lot of that kind of language, and it'll really be looking below that to see what the changes are actually doing to factor in how much money is potentially being taken out of the program.
And just to add there, from a Republican perspective, long-term pollster for the president, Tony Fabrizio, actually commissioned a poll earlier this month on this Medicaid question. There's been a lot of sort of canary in the coal mine talk within Republican circles, within MAGA circles in particular. Folks like Steve Bannon, who are cautioning Republicans with taking a meat cleaver to the program because a lot of the MAGA constituency actually would be impacted by these Medicaid cuts. And so from a top line perspective, just a few numbers here to run through. So favorable view of Medicaid of all the voters that were polled, Tony Fabrizio found a 74% favorable view of Medicaid. Of those, for those who voted Trump in the 2024 election, 61% had a favorable view of Medicaid. Of those voters polled that were quote unquote swing voters, 72% had a favorable view of Medicaid. And then when looking at, the Tax Cuts and Jobs Act and that extension, as Remy kind of mentioned, using Medicaid as a pay for extending the Tax Cuts and Jobs Act, you had folks, all voters, 69% did not actually opposed cutting Medicaid to extend. 49% of Trump voters were supportive of that versus 39, which were supportive. And then 70% of swing voters oppose versus 22. support cutting Medicaid to extend Tax Cuts and Jobs Act. And then when you get into the children's piece of that, right? CHIP, Children's Health Insurance Program, those numbers, are even more dramatic. 71 opposed, 21% support, and that's all voters polled. 54% of Trump voters opposed, 29% support, and then swing voters 71% oppose and 18% actually support. So again, these are things that are very much weighing on members, especially in the House. You've started to see some public statements, public letters, whether that's put forward by members who are a part of the Hispanic Coalition in the GOP conference, or some out of the governing wing, the folks like Valadao, et cetera, who actually in 2017 lost their seat, over this issue, publicly, coming out, putting their name on paper, saying to Republican leadership, hey, let's be more measured here. Let's act with caution when approaching this question. So it's certainly something that is weighing on those more moderate members of the GOP conference with regard to the Medicaid question.
If I could just round it out.
Yeah, go ahead, Clay. Yeah.
Just to say that, I mean, the reason why, or one of the reasons they're targeting Medicaid is because, and Remy did a great job articulating earlier, is because that's where the spending is, and they've taken Medicare and Social Security off the table. So, we've spent a lot of the time today talking about cuts to discretionary spending. If you look at that in comparison to what the entitlement spending is, I mean, it's just orders of magnitude, like so much smaller than the entitlement, right? And so I think one thing, this is another part of we're going to see a really strong policy debate. Brett Guthrie, who's the chairman of the Energy and Commerce Committee, he's very steeped in Medicaid policy, and there's nobody on the House or the Senate side, I would argue, that knows it better than he does. And so as you go look at these debates, I think it's going to be important to follow these closely, because whether it's a work requirements or changing eligibility determinations, these come with huge numbers, but obviously there's a significant amount of policy that's associated with that as well. We should have that debate, right? There should be both sides kind of coming in. But one other to close is, it's what is kind of interesting in this moment is that there's there's so much going on that it took 40 minutes to get to it, right? That this is, and these are significant, big changes, but it took that long. And I think that's going to be an interesting part of the policy debate, and that for the rare community, there are a lot of issues that are on the table, right? In terms of our priorities and how we kind of look at that and engage. That's why it takes the whole community and all the voices, because there's a lot of stuff where education is really going to make a difference, just like the Medicaid policy, the FDA policy, NIH, other areas. It just means the job that much tougher, but that much more important as well, just given the significant amount of changes that are being considered right now.
Yeah, that's actually a great call out, Clay. I will flag that we, EveryLife, will be launching a campaign for the community around Medicaid later this week. So to watch for that, and there'll be a lot of action alerts. So we're going to be ramping up our efforts to engage the community and be able to activate and raise awareness with Congress around the importance of Medicaid for a rare disease community. And to Remy's point, exactly what Medicaid is, because we do also believe, based on conversations we've been having with members and their staffers, that there's just a lot of misunderstanding around what Medicaid is and how it serves our community and what's at stake. Thank you for that actually brilliant explainer around what budget reconciliation is and what's at stake, and how the community can be engaged. I am cognizant of time, but we didn't literally at all talk about all the other legislation that's at play and that Congress is working on, and that is of importance to our rare disease community. And I would be really remiss if we didn't at least talk about the Pediatric Priority Review Voucher Program and that legislation that our community, alongside all of you, actually has been for a very long time working to see reauthorized. So just could somebody just give a quick update on where that stands and what the community should be watching for and potentially calling for Congress to do in order to see that move forward?
So pediatric PRV almost passed at the end of last year, I think, as a lot of you may know. There has been a few attempts to revive pediatric PRV. The issue is less to do with the policy of pediatric PRV, but the politics surrounding the rest of the things that were in that end of the year package. There were PBM reforms, there was a host of other policies in there. And a lot of the folks in leadership have said, okay, we need to stick together and pass everything that was in that package. We can't sort of pick the pieces apart, you know, whether your favorite thing is opioids or mental health or PBMs or PRV, like we can't pass one piece without passing the whole thing. The problem with passing the whole thing, I think, as folks have noticed, Congress is not the most functional body right now. And so to try to move that along is difficult. At least on the Senate side, they have tried to run the hotline on that healthcare package. Running the hotline is a fancy sort of Capitol Hill term for trying to move the bill by unanimous consent. So not having to go through a lengthy floor process, but be able to move quickly. And the folks that have stood in the way of that don't have an issue with PRV. They have an issue with a lot of the other policies. And so that is, I know, for the community and those of us who have been pushing for that, extremely frustrating when you have a good policy that's sort of stuck in a political logjam. I do feel like when we have an opportunity in Congress to move actual legislation, so outside this reconciliation process, when we get back to normal order of business, whether that's the end of September is always a fun time in Congress. That's the end of the fiscal year. We normally have to pass appropriations bills. There's an opportunity to sort of move more legislation. And so I think folks are hopeful that, you know, PRV can at least move this year. We are in that, I'll call it the grandfathering period of the previous authorization. So while so folks that have been designated can still get a PRV in this time, it's that they're not offering new designations. It is still problematic, right? Because it creates some uncertainty for investors. But I do think there is a lot of support and a lot of talk about this program in Washington. You know, both sides of the aisle have champions here, and it's a matter of just sort of shaking it loose from that bigger package.
Great. Thank you so much, Remy, for that. Okay, so this conversation has covered a lot of ground and territory, and we just couldn't have a better team here fielding this for us. So we're just really grateful for all of you. I just want to end with the glimmers that we heard, because there's still a lot of news for everyone to take in, but I think what's really important for our community are the glimmers, the notes of optimism, and the opportunities for the rare disease community that we heard here today, and the opportunities for activation, because there is always something the rare disease community can and should be doing to ensure that our needs and our priorities are the priorities of the new leadership that is moving into their new positions. So this is the moment for all of us. So some of those that I heard were that we have new leadership at FDA and NIH and CMS and CDC who are learning about what their jobs are and learning about what the needs of the American public are, and have yet to understand that 10% of the American public are those living with rare diseases, and we have a lot of data for them to get to understand, and they get to understand what our priorities are. So we need to get those in front of them. We heard that Medicaid is now in play, and we need to have the American public and elected officials understand what Medicaid means to us and what will happen if Medicaid gets cut back, and that all of these innovations and access to care will be compromised, and that will ultimately cost more to the American public if that gets cut back. So we need to message that and talk about that. We heard that the advisory committee for newborn screening was terminated, but the newborn screening program was not, just the mechanism for evidence review. So we can call for the restoration of that. We have a sign-on letter actually that is circulating around that. And we know that because we led appropriations a couple of years ago for the National Academies to do a study on what the future of newborn screening could be, that study is to be released in the coming weeks. So there will be sort of a roadmap for newborn screening coming. So we have lots of opportunities, and that as far as what the budget, what else could be coming as far as cuts could look like, we are going to be seeing lots of opportunities in upcoming budget committee meetings and appropriation committee meetings that will tell us more. And we have opportunities again to be reaching out to members of Congress who will be engaging in those meetings to make sure that questions that matter to us are asked of those who are testifying at those meetings. So again, what we're hearing is develop relationships with our members of Congress who again are pretty new, and make sure that what matters to you and as a constituent is what matters to those newly elected members of Congress. So most of all, we thank each of you, Remy, Caitlin, Clay, and Shane, for always being sort of a guiding light for us in the community and making sure that we understand what's happening and where the opportunities are for us. So thank you for your time here today. We're really grateful for you. I'm going to turn it back to Kenley.
Thank you so much, Annie. And again, thank you to our fantastic panelists. That was an amazing discussion. As a reminder, this will be posted on our website shortly. I just have a few more announcements before we close. Perfect. So please keep an eye out and save the date for an upcoming Rare Disease Congressional Caucus briefing on May 20th from 12 to 1 p.m. Eastern Time. We will be covering newborn screening, a moral imperative. This will be in person on Capitol Hill and available via virtual live stream. You can find out more information on our website. Please also save the date for May 29th from 1 to 2 p.m. Eastern Time. We will have our next RDLA webinar. And again, you can find more information on the Every Life Foundation website. We will also be hosting 2 incredible programs this summer, Rare Across America from August 4th to 15th, and Youth and Teen Advocacy Day for advocates aged 10 to 18 on June 17th. Registration for Rare Across America will open up on May 12th, and registration for the Youth and Teen Advocacy Day will open up on April 28th. So be on the lookout for that. And finally, please remember to apply for the RDLA mentorship program. Registration will close on May 2nd. This is for those advocates looking for additional advocacy support in a more one-on-one format. If you have any questions or we were not able to address your concerns today, please don't hesitate to reach out to us or find more information on our website. You can follow us on social media at any of those linked accounts or reach out to myself at kjones@everylifefoundation.org. or our Vice President of Advocacy, Shannon Von Felden at svonfelden@everylifefoundation.org. Again, thank you to everyone involved today. We're so grateful for the amazing advocacy that each of you do, and please don't hesitate to reach out if you have any questions. Thank you so much.